Any chiropractors in the audience? Okay, we have a few. Practitioners? Okay, a number of you. Who's here for the first time? Wow, a lot of people. All right, well, welcome. The PowerPoint today I'm going to do on Lyme. You don't have to have anatomy and physiology to be able to understand this, because I'm going to take a very simple, a very slow. I'm going to explain step by step what it is, how we got here, how to you find out if you have Lyme or not, and how to eradicate it. So, first of all, what is Lyme? You hear a lot of talk about Lyme. But Lyme is an infectious disease caused by a spirochete bacterium, usually Borrelia burgdorferi, which is transmitted by deer ticks, also by mosquitoes, ants. Oh, actually, there we go. Ants, bed bugs. In fact, any biting insect has the propensity to give you Lyme. It also can be passed on by unprotected sex, through blood transfusion, and you can pass it to your children through their birthing process. It is called a bacterium, but does not live in the blood. The spirochete is a spiral shape. It can easily invade the cells and organs of the body in a corkscrew fashion. For this reason, traditional methods of using antibiotics are very ineffective in eradicating Lyme from the body. It will manage it, but it will not get rid of it. In fact, some experts think that as many as 1 in 15 Americans carries the spirochete bacterium, making the Lyme one of the most infectious diseases in the world. Now, Lyme gets its name from Lyme, Connecticut, where a group of teens suffer from a debilitating arthritic condition in the early 70s. By the mid-70s, scientists figured out that it was a deer tick that was invading or was producing this bacterium. However, in 1981, a Swiss-American scientist by the name of Willy Burgdorferi identified the bacterium medium, and of course, because he the one to discover or identify, is going to name it after himself. That's why we know today as Borrelia burgdorferi. Now, that would be problem enough if it was just one strain of Lyme. Unfortunately, there's over 11 different strains of Lyme that can affect an individual. That's the reason why there's so many different medium. It's not just a tear tick that you can get it from. You can get it from just about any biting insect that can bite you, has the propensity to give you Lyme. As a result of the findings, many people think that this is just an American disease or that it's just in the Northeast. But as early as the 1920s, Swedish scientists discovered that yes, there's also Lyme disease in Europe. Of course, we now know that Lyme is all over the world. In fact, a little side note, about 3 weeks ago, I was in Chicago taking a class on dark field microscopy, and there was a lady there that she flew all the way from Australia to attend the class. There was also a gentleman from Canada, and we're kind of reminiscing on, she asked me what I do, what is my specialty. I told her it was Lyme disease is really my specialty. And it goes that in Australia, doctors are ignoring the problem completely. I say, I see it every day in my practice, and they just ignore it. And in fact, her son is a medical doctor, and they tried to incorporate the two things together. But Borrelia burgdorferi is mostly found in the US. However, there's also a number of European strains like Borrelia afzeli, Borrelia guerini, and Borrelia henseli. But that's not all. Besides the spirochete bacterium, you also have to deal with co-infections, which run together with the Lyme. Infections like Babesia, Bartonella, cytomegalovirus, malaria, Mycoplasma fermentans, Rocky Mountain spotted fever, West Nile, black mold, Lone Star, tularemia, protozoa, and powassan, just to mention a few. Please wait till after we get done for questions, because I have a limited amount of time, and my time was just cut short by a little bit. So Please wait till after I get done for all questions. So you have to deal not only with the spirit gut bacteria, but you have to also deal with all these co-infections that run together, in addition to secondary infections, like herpes viruses. They all run together. Candida, it runs together. And you have to be able to get rid of all those things before you can get a true healing. Well, how do you contract Lyme? As I said before, there's many different ways. But one way would be, if you see a little bug crawling around your hands, and you get bitten by it, and then you develop a red rash, there's a good chance that yes, you have Lyme. When it is a tick that bites you, it does it in a very unusual way. First of all, it will administer an antihistamine on your skin, so you don't feel the bite. Then it will secrete a cementant type product, which is like a glue type product, so it can attach itself to you. Then it takes its jaw bones and shoves them into your skin. Then it begins to suck your blood. Suck and suck and suck, and you see the tick getting bigger and bigger and bigger. It will stay on an animal anywhere 5 to 7 days, but it will stay on a human a lot less. But when humans are infected, the spirit gut bacteria can go anywhere in the body, including soft tissues, joints, particularly the major organs of the body, like the brain, the lungs, the liver, the spleen, the optic nerve. And the unnerving part about all this is that the majority of people that are infected have no idea they are extremely sick. Now, how would you know if you're affected by Lyme? Because Lyme can mimic over 350 different diseases. So how would you know? Well, it depends on the type of strain that you have and the type of co-infection that you have. So let's look at a few. Borrelia burgdorferi, with this kind of strain of Lyme, there will be joint aches, headaches, fever will be up to 100 to 103. Neck stiffness, swollen glands, fatigue may occur with or without symptoms. Other joint pains would include stiffness and swelling, particularly the large joints of the body, like the knee, the elbows, the shoulders. The bacteria can affect the brain, the spinal cord, and other nerves of the body. That's if you just have one. But let's say you also have these other problems. The Afzeli strain. With that strain, there will be, this is mainly in Europe, but because of all the interchange of people traveling back and forth, now it's been commingling through the ice as well. The Afzeli and Guarini strain are mainly European, but we also find them in the US. With this, there will be chronic skin inflammation. The peripheral nervous system will be affected, especially the feet and the lower legs. The incubation period will be long. It could be months or even years before you even have any symptoms. The process is slow and insidious, with purplish discoloration and swelling of the skin, and eventually skin atrophy will develop. What about if you also have this little critter with you, in addition to the aforementioned ones? There will be neurological symptoms with the Guarini strain, like back and leg pains, partial facial paralysis, which usually reside in the cerebrospinal fluid. Patients infected with Borrelia Guarini tend to be older with skin lesions located in the trunk. Guarini has a shorter incubation period compared to other Borrelia strains, and it is also associated with abnormal liver functions. Let's take a look at our next culprit, the Hantzeli strain. Hantzeli has a well-established ability to infect the central nervous system. Cases of encephalitis is well documented by the medical community. Patients also complain of persistent headaches, restless and combative behavior. They can develop seizure, lymphatic coagulations, dementia, followed by encephalopathy and loss of vision. Now, if you just had this many critters with you, that would be problem enough. But now you also had to contend with the co-infections. And there are over 150 co-infections. But because of time allowed to me, I'm only going to speak about 2 or 3. Babesia will be the first one. Babesia is caused by a protozoa that invades the red blood cells, and it can cause malaria-like symptoms. And it's transmitted by the identical bug that delivered the Borrelia burgdorferi to you. 41% of people with Babesia develop serious complications, which may include acute respiratory failure, disseminated intravascular coagulation, congestive heart and renal failure. Babesia is also associated with the presence of anemia and parasite infestation. Bartonella is often mild, but in more serious cases, it can affect the entire body. Early signs will be fever, fatigue, headaches, poor appetite. Swollen glands are typical, especially around the neck and the arms. Also gastritis, lower abdominal pain, sore soles, tender subcutaneous nodules along the extremity, and enlarged lymph nodes and sore throat. This next one is an interesting man-made organism. You have trouble concentrating. You have short-term memory loss. You feel like you're trapped into a brain fog. You have unexpected muscle aches, joint pains, like a never-ending flu. Your spouse and family do not understand this metamorphic change in you, going from vibrant and alive to sick and decrepit in the prime of your life, almost overnight. Nobody understands you. I can read some of you. Nobody believes you. Nobody cares. Nobody offers help. Well, almost nobody. Thanks to the research of Professor Dunscott and Dr. Garth Nicholas, there is a growing awareness of a mysterious debilitating illness that is affecting 800,000 people a year in the U.S. alone. It's being carried dormant by everyone in North America, waiting to be triggered as molecular terrorism. This man-made hidden stealth pathogen is named mycoplasma, and it is the common culprit in most every disease process known to man, including AIDS and Lyme disease. The next logical question would be, how would a person know if they have Lyme? Well, obviously, if you see a tick on you and you develop the rash, then you have Lyme. But only 30 to 40% of those people ever bitten by a tick ever develop a rash. 20 to 30% others will have joint pains and swelling, but the majority have no symptom whatsoever for months, years, or even decades later. As I mentioned earlier, there are many different ways that you can contract Lyme, including, obviously, ticks, brown recluse spiders, mosquitoes, ants, birds, mice, bees, bed bugs. If they can bite you, they can give you Lyme. In fact, the latest studies show that 60% of mosquitoes today carry the spirochete bacterium. So to give you an idea how infested, I call this this disease a biblical proportion, because there's no place in the world that you can go that you can be free of Lyme 100%. So let's say, okay, you think you have Lyme. What is the most accurate way of identifying, yes, I have Lyme, I have this strain, I have that strain? Well, since its inception, the main focus has been in developing an accurate test for the Borrelia burgdorferi antigen, the causative agent of Lyme disease. According to a clinical study presented at the Lyme Conference in 2003, the best test available, which will be the gold standard according to allopathic medicine, is the PRS blood test. But get this, their gold standard is only 30 to 35% accurate. The Western blot comes in a little bit better at 50%. Other tests like the Luata, the ELISA fall far below this level of accuracy. So in the final analysis, a blood test is not the best way to identify if you have Lyme or not. The main reason is because the spirit gland bacteria does not live in the blood. It lives in the cells of the blood. It's only in the blood when it's traveling, when it's moving around. Lyme has a 4-week cycle. It becomes active, then it goes dormant. Becomes active and goes dormant, back and forth, back and forth. And it usually becomes very active around the full moon. I challenge you to watch people around the full moon and see how they react. They're more agitated. You know, they have less patience. Well, that's because you have the spirit gland bacterium in there, and you also have parasite, which also they multiply every 4 weeks, doing their thing and making things, you know, bad for the people, and that's why they're more agitated. Dark field microscopy is a little bit better way of determining whether or not a person has Lyme. But the problem is that you have to remember that once you puncture the skin, the spirit gland bacteria notice that, and it will develop a defense mechanism against it. It's a very extremely smart pathogen. So if the technician knows what to do when he's looking for Lyme, he will smash the cell, and then you can see on the screen. But it doesn't happen always that way. Sometimes what you have to do is to puncture the skin, allow the blood to rise, to make it like a little dome, and then turn the slide over and do 6 spots. Then turn the slide over and let it dry for 2 hours, and check it, and see if there's movement in the slide. Sometimes it does, sometimes it doesn't. Because the spirit gland will sense danger, and it will cluster it. You cannot see it under a microscope, the cluster. So